Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Forum on Safety. My name is Peter Lattanzio. I'm the Chief of the Town of Colonie Department of Fire Services. And here with me today, once again, is Deputy Chief Peter Berry from Colonie EMS Department. Pete, thanks for being here once again.
Thanks for having me, Pete.
I asked you to kind of enlighten us a little bit about the flu and all the noise that we're hearing on the news today about the flu. And I just wonder, too, if people are a little confused about some of the terminology that's being thrown around. We're hearing the seasonal flu, we're hearing the swine flu, we're hearing the H1N1 flu. Can you kind of sort those out for me a little bit, and is anything overlapping there? And
Sure. I think one of the biggest challenges that we're experiencing here today is that there are so many different sources of information through the media, the internet, and people are getting confused. We do have the normal type A seasonal flu that we experience every year that is going to be around, and we should always take appropriate precautions for that and get the influenza A vaccine, which is available right now through almost every pharmacy in town and through your own healthcare provider. And then we have the H1N1, or what was initially thought of as the swine flu. They are the same thing, but the correct terminology is to call the flu the H1N1. H1N1 is a slightly stronger strain of virus that is coming around and has been identified by the WHO, the World Health Organization, as currently a pandemic, which means they've had cases appear in numbers more than normal. Here in the United States, we have had a large number of cases reported to the CDC, upwards over 1 million cases, and there have been some deaths in the United States related to H1N1. Currently, right now, and I think one of the things that's got people confused is currently they're looking at all flu cases that are currently identified here in the area as H1N1 because that's what is most prevalent currently. So there is a lot of confusion because there's talk about seasonal flu, H1N1, and they're still using that word swine flu occasionally, but really it's H1N1.
you threw out a couple of things there, and I want to pick them apart a little bit. The seasonal flu that's out now, you said that you can go to your healthcare provider or most pharmacies, and the shots are available for that, correct?
Absolutely. I know CVS, Walgreens, Rite Aid, your Price Chopper and Hannaford Brothers, the pharmacist, recently a law was passed that allowed pharmacists to give the vaccine. The vaccine is available. Go to the websites, call your local pharmacy. They have clinics running every day. They have vaccine available. And also your healthcare provider, your personal physician, your primary care physician has vaccine available. Again, they can go there and they can get the shot as well.
And the H1N1 vaccine, I'm just hearing now that it's just starting to come out and be available, but it's not available to the general public, correct?
That is correct. The vaccine is becoming available. There has been multiple broadcasts on the national news of people being administered the nasal form of the vaccine, which is being first available. We had just received some reports now that Albany County has received its first shipment of the H1N1 vaccine, and they are starting to distribute it to healthcare workers in the hospitals and to pre-hospital care workers, EMS.
The traditional flu that we're getting the vaccine for, that's an injection, correct?
You can get it either way. You can get it nasal. It's a little bit more expensive, or you can get an injection.
Okay. But it looks like the H1N1 will probably be. Is that going to be offered the same way too, both versions?
It will. Initially, the version that came out first is the nasal administration, but there will be an injection form out that will come out shortly.
What can folks do in general, to prevent from getting either flu or both flus? And I guess another question, and we'll let you do these one at a time, can you get both flus at the same time?
Well, that's a very interesting. You can, because they're different strains of the virus. You can get H1N1 and then have antibodies for H1N1 and still get the seasonal flu. You can get the seasonal flu and then still get H1N1. That's why we're really encouraging everybody to get both vaccines when it's available. As far as what you can do to prevent the flu, it's pretty much the same for whether it's H1N1 or the regular seasonal flu. And really the best thing that people can do is help break the chain of infection by washing their hands. And it's not just putting a little bit of soap on your hands and rubbing them together and washing them. You really have to put some soap on, and you have to vigorously rub your hands together for approximately 20 seconds. They're teaching kids today in the school districts to sing happy birthday while they're washing their hands. And that really is the most important thing you can do. They've done some studies and statistics that adults put their hands to their mouths, nose, and eyes about 18 times a minute. Children do it about 80 times. So really, one of the things that's extremely important is to educate our children to wash their hands frequently, break the chain of infection, and again, for adults, same thing. Wash your hands, and again, try not to touch your eyes, nose, or mouth until you've had an opportunity to do that.
And I've also seen some literature out there, and I've seen some commercials even on TV that you have a cough, don't cough out so you can expel material, but you should be coughing into the sleeve of your coat or into your crook of your arm?
Absolutely. Education for everyone about cough etiquette, hand washing, and again, also to help stop the spread of the disease, staying home when you're sick. We're really trying hard, and I know that we recently had a meeting with both the North Colonie School District, South Colonie School District, and some of the private schools in town, and the nursing staff and the the teachers in all of those institutions are really pushing forth hand washing and cough etiquette. We're also talking about distancing too, not keeping people close and consolidated together, but trying to spread them out as much as we possibly can. And it's hard in a school environment to do that, but to spread them out as much as we can and distance people apart. So again, we can break that chain of infection and hopefully stop that spread from one person to another.
You said something about staying home if you don't feel good. Are the symptoms similar for both flus, and what are some of those symptoms? And again, I think we're so accustomed to going to work or going to school, even if we don't feel the best. That's not what we should be doing, though, correct?
That's what's really hard about this. I mean, let's face it, on all of our work environments, and especially in yours and mine, we have some very dedicated people that even come to work when they're not feeling well. Because they're dedicated, they want to provide service to the community, and they want to help people. The problem is that in some cases we need to be advocates not only for ourselves but for our patients as well. And if we're feeling sick, we have a fever, we have cough, chills, diarrhea, body aches, we need to stay home. And that really, the key thing that we're focusing in on is the fever. If you have a fever, you need to stay home. And you need to stay home until you're symptom-free for at least 24 hours, and those symptoms are not masked by Advil or Tylenol.
So at least 24 hours. So again, if it's a couple days that I'm not feeling good, I'm running that fever, stay home that extra day just to make sure that I'm not going to be able to pass this on to
Right, you want to be
somebody else.
symptom-free for at least 24 hours so that you're not going to pass it on to someone else. And in our industry, we want to be advocates for our patients. We want them to feel safe and secure in our ambulances, and we don't want to provide them with a sick provider.
Is there some target populations that should be more concerned than others? I've heard that you're looking at young people, women that are pregnant, people with respiratory issues, but surprisingly I've heard that not so much maybe for seniors this time around because they may have been exposed to a strain of flu similar to H1N1 several years ago?
Actually, H1N1 has been around a couple of times, and they really feel that some of the older segments of the population may have some antibodies, so they haven't been targeted as a priority. However, one of the things that's confusing people about all of the different talk about flu is they are still a target for seasonal flu. Right. So it's still highly encouraged that the senior population get the flu vaccine. They are targeting, because of the limited amount of vaccine for H1N1, they are targeting certain subsets of the population, such as pregnant females, people with chronic diseases such as breathing problems, asthma, things like that. They are being targeted as high-profile cases that should get the vaccine first. I believe that after the target population has received the vaccine, they will make what vaccine is available to everyone else as well.
You mentioned before that there's been 1 million or so cases reported through the United States, and I know that there's been quite a few cases reported throughout New York State. I also believe there's been a couple of fatalities in New York State too, hasn't there?
Unfortunately, there has been. The latest CDC numbers report about 84 deaths in New York State. There was a New York City police officer and recently a Cornell College student that passed away from H1N1. That's why I think it's so important that we increase awareness in our community and we do everything we can to educate people on breaking the chain of infection, and that includes cough etiquette, distancing, washing your hands.
When you say distancing, I mean, sometimes it's very difficult. You get onto a crowded bus, you get into an elevator with somebody. Our society is very mobile. You get onto an airplane, so it's difficult in a sense to distance. But when you refer to a distancing, are you talking feet? Are you talking inches?
Well,
are you talking to keep somebody in the next room away from you?
The CDC recommends about 6 feet, but obviously in some of those scenarios that you described, you can't do that. But then what we really want to try to do is with the cough etiquette and hand washing is really educate people that when you're touching things that may be cross-contaminated, things like doorknobs, the railing on stairs, the handrails on an escalator, the bars in public transportation that you have to hold on to when you're standing up in a bus or a subway, is that realizing that when you're touching those surfaces is that you've got potentially bacteria on your hands and not to touch your eyes, your nose, or your mouth.
And that bacteria can live on those surfaces for quite a while, correct?
Sometimes anywhere from a couple of minutes to a couple of days. So it's very, very important to always consider those surfaces contaminated, and if you do touch them, don't bring your hands to your mouth, nose, or eyes.
I know in the town, and especially the town buildings, they've been very conscious of this. I know you sit on a committee looking for this in the town, and they've started a very aggressive campaign of wiping down those doorknobs, railings, in all the public areas. But that's not probably the common thing throughout a lot of our buildings that we're going to go into on a daily basis.
I think the thing that's important for everyone in the town of Colonie to know is that the town has been very aggressive at establishing a flu committee and establishing policies in all of our public buildings to provide hand sanitizers as you come in, to provide education on breaking the chain of infection. And we have a very active committee that's developing policies to maintain critical services and infrastructure, to maintain public safety, and making sure that all of our employees are appropriately trained and outfitted with the appropriate PPE and materials that they need to have a clean environment to work in.
Excuse me. One of the things, again, I've heard from you is we're going to stay home if we're sick. And again, I think we're in that mindset that I've got to get back to work as quick as I can, but part of your committee has gone and looked at what are we going to do if there's a large outbreak, especially within the town of Colonie. How are we going to keep those vital services running? Because even though I may not come down with that flu, I may have a family member that comes down, so I may have to stay home and be the caregiver for that person. So again, part of your committee has been looking at all that, correct?
Right, and one of the things that's really fortunate, Pete, is that the influenza A vaccine is widely available, and we're really encouraging all town employees and everyone to get it that can get it. Now that the H1N1 vaccine is now available to critical infrastructure and public safety people, some of our staff are starting to receive the H1N1 vaccine. Matter of fact, there are some clinics coming up this week. So what we're really hoping is, from a public safety perspective, we're going to be able to maintain our operation at current staffing levels and be able to provide effective service. So we're hoping that we're not going to be impacted that well. We're very fortunate here in the town of Colonie. We haven't had the extent of the outbreaks that they've had experience in some of the southern states. We've got great surveillance through the Albany County Health Department. We're monitoring the situation, and I think we've been fortunate so far. I think it's a little bit too early to say that we've dodged a bullet, but I think that the vaccine is now available here in Albany County. I think we're getting it out to the right people, and hopefully we can hopefully dodge the bullet.
Well, I know that you guys have been very aggressive, and I've been to some of those school meetings with you, and you are monitoring what's going on in all of the public and private school districts. What about a place like Siena College and other facilities like that? We've got Bryan and Stratton, we've got a few other colleges. Have they been brought into the loop too, so that we can monitor and know what's going on in those facilities?
We definitely have heard of the implementation of policies that those institutions have. Like Siena College has instituted a strong surveillance policy, and that when a student is identified as having influenza-like illness, they're sending them home. So they've taken a very aggressive approach to this. We believe that Bryan and Stratton and other places are also doing very similar things. One of the things that's very fortunate is through the State Education Department, through the CDC and the Albany County Health Department, a lot of this information is being pushed out to these institutions, and they're implementing plans to not only reduce the risk of infection, breaking the chain of infection, but identifying sick people early and sending them home.
I've not heard a lot of severe cases in this area. Do you think all this awareness and everything that's going out is making a big difference?
I really hope so. I know that all of the healthcare institutions and workers in the area have been working hard at this. I know that the federal government and state government and local government too has been actively involved in providing education, producing policies, educating staff to try to minimize the impact that this will have on us.
Is there going to be a peak period for this H1N1? I mean, if we get through the November, December time period, are we kind of over the hump, or is this something that we're going to have to keep an eye on for the entire flu season right through till springtime?
Well, I think H1N1 is here. I think it's going to come in waves. They're predicting it's going to come in waves. Hopefully, if the vaccine gets out and the virus stays relatively stable, the vaccine will be extremely effective. I don't know that it's safe to say that we can eliminate H1N1. I think it's going to be in our future, but hopefully we can minimize its impact with the vaccine and the policies and defense mechanisms that we put in place.
We're talking about being prepared and what we can do at home and what some of the signs and symptoms. September, which we just got through, that was National Preparedness Month, correct?
Absolutely. September was National Preparedness Month, and really what we wanted people to do during National Preparedness Month was to take a look around their homes and do things and take measures that would allow them to survive in the event of a natural disaster. Whether it's H1N1 or it's a bad ice storm here in town,
We just went through
or
that.
anything that would have an impact on services for several days. So what were some common sense things to do? Make sure you had food and water on hand for several days. Make sure that you had over-the-counter medications to get through the flu and any other natural disaster, such as Advil, Tylenol, anti-diarrhea medication, anti-nausea medication, and prescription medication to have at least several days on hand so that in the event of a disaster situation, you'd have the things that you need to survive for several days. Also looking at other things too, things to keep you warm, but not necessarily doing, and I know you're very concerned about this, but doing alternate heating sources in the house.
Yeah.
But looking at all of the things you need, things to keep you warm, things to eat, things to drink, and those medications that you need to get through those several days, because we really encourage people to do that during September, during National Preparedness Month. And again, we're also hoping that people that did take the time to do that will really fend very well and get the vaccinations that they need to get through the H1N1
So that's
wave
all
coming.
part of the package coming through.
Absolutely.
I think you were just talking about being prepared, and the ice storm came right to my mind. And we were out in sections of the town, we were without power for up to 2 weeks in some areas.
Right.
And we actually ran a couple of shelters in the town, and I don't know if a lot of people even realized that option was available to them. I know the one in Colonie Village at Colonie Village Hall, that ran for just about the 2-week period, and they housed people throughout the whole event. And I think people need to understand that those type of resources are out there for them too in the event of an emergency like that. And the power goes down, you may not be able to watch your television to find out what's going on. And I don't know how many of us have got battery-operated radios anymore.
Right.
But you should know that there's facilities out there. And I think a part of preparedness is, where could I go if something happens?
And I think as winter approaches, and we are common to some pretty severe winter storms here, that we take a moment and make sure that we are prepared for that, and that we have all the necessary things to weather that storm, including knowing where to go in the event that you can't stay home. We're very fortunate here in Colonie. We have a lot of resources. We have a lot of buildings out there with generators and the ability to provide cooking and bathrooms and shelters and things like that. and that we have some pretty good emergency plans, and we have a very unique management team in emergency services. Guys like yourself, Chief Hyder, the town supervisor, Mike Rayball from emergency management. We have a very unique management team here in town, and we all work really well together when something bad happens, and generally we're able to minimize the impact on the town residents and get life back to normal as quickly as possible.
And again, I think just knowing what resources are available, knowing that you have some options, you don't have to stay in that cold house. We had several incidents last year, and you kind of mentioned it a little bit about alternate heating sources, and we had people running their barbecues in their house, and a couple of folks we had were very fortunate that they didn't get themselves into more trouble because they were severely poisoned by carbon monoxide, and I believe it was in the village of Scotia that they had an individual die of carbon monoxide poisoning. So trying to stay home and stay warm may not be the best option. You may want to go someplace else.
Absolutely, and I think as people understand that we have those types of facilities available here and there are places to go, you don't have to take risks like that by running alternative heating sources at home. And carbon monoxide is a huge risk, and we have seen many times, every season there's some sort of tragedy related to carbon monoxide. We really want to do everything we can to avoid that.
And again, at these shelters, you could go down for a couple hours if you wanted to, have a meal, sit and get warm. And I know there was quite a few people took advantage of at least the one in Colonie Village, but there was the opportunity there for a lot more folks to come in. And I think we just had a hard time getting the word out to people that this was available. So I think that all very much ties into this, being prepared, batteries and flashlights. Make sure you have working smoke detectors in your homes. Things along those lines are all very important. And, you know, we talk about it for the month of September, but it really should be a year-long project that folks have.
Absolutely. I mean, we're coming into October. You know, the time is going to change again. We've always encouraged people to change their smoke detector and CO detector batteries when the time changes. And again, as we get closer to winter and we're closing our houses up tighter and tighter to reduce energy costs, we've got to make sure that our smoke detectors and our CO detectors are working.
Looking too, you know, we talk about preparedness. How about having somebody come in and take a look at your furnace now? Do that tune-up on your appliances. Make sure that they're prepared for the winter, they're ready to go, so that if there's been something that's occurred over the summertime, that we're not going to run into issues. And you know, we see it quite a bit with faulty furnaces, vehicles run in the garage, a variety of things, but we get quite a few carbon monoxide calls in the town of Colonie, and a lot of these could be prevented by, again, being prepared and a little bit preventive maintenance.
Absolutely. I think you know, you've hit the nail on the head. I think if we can get people to take a little bit of extra time and be prepared, take a little bit of ounce of prevention, we can avoid a lot of you know, unnecessary accidents.
You see anything else? I mean, we've kind of given people a heads up today about the H1N1 and the regular flu. Anything else on the horizon that we should be kind of gearing up for or being preventative about? I mean, the common cold is out there. And a lot of those things are all going to be lumped together as taking care of yourself the same way. You don't feel good, stay home. Prolonged symptoms, seek medical attention.
Absolutely. One of the things that everyone in healthcare is encouraging people to do is that when you're sick is to get your primary care physician involved. Reach out to your primary care physician, consult with them, get appropriate medical direction from them. There's all kinds of sources on the internet, the CDC, the county health department, but again, get your primary care physician involved when you're not feeling well in your home. They are best to direct you as to what to do.
We covered a lot of information here today. Hopefully people will take some of this information and put it to good use. Again, they don't feel well, talk to your primary physician, your primary care physician. You don't feel good, stay home. Hand washing, I mean, I think we pretty well covered a lot of the hot topics there in that area. I would really want to thank you for coming in and bringing this information to everybody. Like I said, I think the awareness has maybe made a dent in it somewhat. Again, I've been to a lot of meetings with you, and a lot of these programs are going on, and the word's getting out there. The schools are educating the kids. I know that the senior population, there's a lot of information coming out there. I see stuff constantly on the nightly news. So I think as our generations are changing. We're becoming much more involved in the media and much more linked to each other. It's a good thing in this sense because we're getting a lot of this information out there, and hopefully that's going to make a big difference.
Well, I think the biggest challenge for all of us is to stay informed. There are multiple sources to do that. Sometimes it's a little bit confusing because some of the information may be a little bit conflicting, but I think if we're staying in tune to what's going on and we're informed about it, it's the best chance to be prepared for something, take appropriate measures, and hopefully minimize its impact. And I'm really hoping that with all of the education that's been done, with all the information that's out there, whether it be in the media, on the internet, or something that you read in the newspaper, or something you get from one of our shows, will help minimize any impact that they might have.
And I think people need to take this seriously. I mean, we've been hearing about this for months. I know that this started back in the spring and it kind of dropped off over the summer, but like you say, it's going to come in waves. People can't become complacent with this either and think, okay, well, we haven't seen a big outbreak, so it's not going to be a problem. But the potential is always there for this.
Absolutely. I think, again, we need to really educate people to take care of themselves, to help break the chain of infection so that they can stay healthy, they can keep their families healthy, and again, they can weather this particular storm, whether it's a bad snowstorm or an ice storm, or it's the H1N1.
The other thing that I just want to bring up quick, and we've talked about this at a few of our committees, is looking out for each other and looking out if we've got some elderly neighbors or you've got some folks, in your neighborhood, keep an eye on them. And if they don't feel good, give them a hand maybe and reach out to those folks. And if they need to get to the store to get some generic medicine, or they need that ride to their physician's office, or you can make the call to the physician's office. But I think we need to also kind of keep an eye on our neighbors a little bit too and make sure that we're watching out for each other. And I don't know if we do that so much anymore in our neighborhoods, but I think that's really important that we start looking out for each other a little bit.
Absolutely, I agree. I know the police department has worked hard at it. We've worked hard with educating in some of the senior groups to really have people watching out for one another, developing neighborhood organizations, so that again, when some form of a disaster hits, they've got somewhat of a group together that's looking out for one another, taking care of one another, so that they can sustain themselves until emergency services can get there, which could be some time in the event that it is a big disaster. I just wanted to recap one thing, Pete, is that we really want people to direct their questions and concerns towards their primary care physicians. But in the event, it's on a Friday night, it's on a weekend, you can't get a hold of somebody, you're concerned, you're not feeling well, you're not sure what direction to go in. Again, we are the safety net for our community. We are the Emergency Medical Services Department. Again, if you're concerned, you're not feeling well, you can't get a hold of your primary care physician, never hesitate to call us.
And I know that you guys are always there. You
Absolutely.
have a very well-run organization, and you put a lot of miles on the road serving a lot of people. So for that, we appreciate that.
Well, and thank you, and thanks for having me on the show.
Thank you. This will wrap up today's show. Obviously, if you ever have any questions, don't hesitate to contact here at the library or at the Town of Colonie Fire Services office, and we'll direct your call or your question to the appropriate agency. So we'll see you again in the future. Thank you.